Every year, 20,000 soldiers go to the Army's substance abuse clinics. They go there either because they're sent by their commanders because they've had some kind of alcohol or drug-related problem, or they go there because they simply need help. At the clinics, they get screened and assessed to find out whether they have any kind of drug or alcohol-related problems. Psychologist Wanda Kuehr, who just retired as the Director of Clinical Services for that Army program, talks about what that program has to accomplish.
The mission of the clinical ASAP is to support Army readiness through providing clinical services to the soldiers who are impaired with substance abuse issues.
After 14 years of war, American soldiers can be suffering from any number of issues. They can have post-traumatic stress disorder, traumatic brain injury, be having chronic pain with wounds or injuries, and they may even have thoughts of suicide. A nexus for these problems can be the abuse of alcohol or pain medication.
In terms of trends, we see particular drugs becoming popular in some locations, but the most abused drug is alcohol still, and it's been that way practically forever in the Army.
In 2010, the Army shifted its program for treatment of soldiers from the Surgeon General's office to the Installation Management Command, the people who run garrisons. What followed after that was that they lost a lot of talented counselors and clinical directors, and the quality of care suffered. One result, Wanda Kuehr says, is that many of the soldiers who should get help were missed.
Last year, over 7,000 soldiers were screened and not enrolled. That is considerably larger than the number of soldiers in a brigade combat team. So it really is an issue of concern.
The consequences of leaving a soldier to languish in alcohol abuse or drug abuse can be tragic.
Some of the soldiers that were screened and not enrolled have gone on to commit acts of violence and sometimes have killed themselves after that as well. So while we can't say that we could have saved folks, we can say that we need to do a better job of treating them.
Kuehr explains that it's possible to fix this problem, but it takes a collaborative effort. It takes integrated services to help soldiers that can have a group of problems all happening at one time.
A lot of collaboration is required in treating substance abuse because many times there are numerous health factors that have to be addressed, and the soldier has to be treated as a whole person and not just treating one part at one place and not even talking to other providers.
For more on this story, visit usatoday.com.